there, and welcome back to another episode of ANEA on the Air. Thank you so much for joining us on this World AIDS Day. Today is a reminder that while we honor the progress made, we must also confront the reality that LGBTQ folks, people living with HIV, and other marginalized communities are facing increasing erasure under the current administration. Policies, funding decisions, public rhetoric are all putting decades of hard won advocacy at risk. And so that's why we're here today. This show is about checking in with some of our advocates on the ground, who's out there doing the work, fighting for equality and the right to thrive. And so we'll see what they've been up to since we last checked in with them and also what's going on now. So we're going to go ahead and get into it. And so joining us back again is Rosa. And for the first time, it's Michelle. So thank you so much. Welcome, Michelle. And so before we get into our first question, I guess I just want to ask you all to introduce yourselves, who you are, what you do, where you are, and also just let us know how you're doing.
I can go. Hi, I'm Rosa Barber with Partnership to End AIDS Status. We are based in Tennessee, Memphis, Tennessee, the hub, Bible Belt, all that good stuff. We are an organization who was established in 2009 by a group of educated women, African American women who saw that there was a need in our community that was far gone from the world's perspective, and so they put the boots on and was like, let's do it. And so we've been going strong since 2009. How I'm feeling right now is I'm stuck between a rock and a hard place. I'm just gonna put it that way, with everything that's going on with our climate, as well as just how things are playing out. So yeah. But otherwise I'm good.
Thank you so much, Rosa. And what about you, Michelle?
Hi, excuse me. I'm Michelle Anderson. I am from Memphis, Tennessee. I'm the special events and volunteer coordinator with My Sister's House Memphis, which is an organization here in Memphis that builds tiny homes for trans gender non-conforming and anyone who is facing homelessness. We're building tiny homes in the Memphis, Tennessee area. We have 11 homes so far, and we're working on building more to just bring housing justice to the people who may experience homelessness or any I would say any barriers to housing. At this moment, right now, I'm kind of partnering. I'm piggybacking off of Barbara. It's between a rock and a hard place because this administration has really done some damage to the work that we have already were putting forward, and trying to help people in between those in these times right now. It's kind of difficult, but we're still thriving.
Thank you so much for sharing. It's so great to hear from both of you. And so this show is actually kind of a follow-up to a show we had a couple of years ago, which Rosa, you were a part of. And back then, Tennessee had just experienced the rejection of their CDC funds by the governor. And I know you all were responding to that, doing some coalition building, working together. And it was great to hear from you and some of your other folks from Tennessee. And so I wanted to ask, looking back now, what stands out most to you about that moment and how your community responded?
Whoa. So, yes. During that time, so in 2022, it was like we were gut punched when our funding was taken away, because we had began to break those barriers, break the stigma. We were getting traction. The word was getting, it was like a lot of boots on the ground in Tennessee. And then it was like in a flash, it was like Thanos with his glove, just like boom, it disappeared. And it was like a good punch to us in the community, and almost like a slap in the face when it comes to our advocacy, when it comes to getting the message out about HIV and AIDS, and hepatitis C, and homelessness, and those who are impacted the most, which are people of color. And we are still those marginalized communities, but guess what, we are resilient, and when there's a will, there's a way. And so, although we've had some funding scrap, we also, thank goodness, have some people who believe in the mission. And so the fight has continued. No, we don't have the resources that we used to have, but I still have faith that one day, the message will become clear. And hopefully, my prayer is that it does not have to hit our government, or our federal government, or our administrations home. Has to hit home first for people to realize that this is an important mission, and
Mhm.
it's not just about one demographic, or one sex, or one race, or whatever. It's us as a human, and it's our civil right to be able to access what we need to access at that moment. And so, just the ripping of Medicare and Medicaid and Ryan White and all of these things that was benefiting to our community, is just really heartbreaking. But as I said, we are resilient, and so we try to scrape up as much as we can. Our executive director, she would go in her pockets really quick to fund things that we need, because even although some of the funding, like once we got that script, we could not buy syringes with federal funding and or state funding, where we could buy other items, and people need clean syringes. Let's just be real. So
Mhm.
the director said, okay, well, I can get on there and go to Amazon and get us some. We'll buy a box at a time if we have to. We'll buy two boxes at a time. We'll get out here and do fundraisers. We'll try to get stakeholders. We'll try to get donors. Just anyone who could believe in our mission. And so, because it impacts all of us. But it's unfortunate that being in the South and being in the Bible Belt, that's one of the number one factors of some of our people. So I wish we had a governor who stood 10 toes down, but it will come away. It will come someday. I know I just ran, thank you. But that's just reflecting back 22, and now we 3 years later. That's where I just reflect back to where we were and where we are now, and just seeing that we are resilient people. And
Mhm.
so we're gonna make it work. It's gonna change. A change is gonna come sooner rather than later. I'm believing in that.
Mhm. Thank you so much for that. And Michelle, I don't know if you were in Memphis at that time. Did you have any thoughts you want to share?
Um, yes, because actually I was a an HIV case manager at that time when the funding was stripped. Um, and I was working for one of the organizations that they actually poured, that United Way poured into the prevention, the
Mhm.
um, funds that they did receive for prevention. But I can say that the when that happened, it was a lot of, like Rose said, a lot of discombobulation on trying to figure out, where do we get this funding? How do we stop it? Because the ball was rolling for the prevention,
Mhm.
but we ended up getting that stab, and it slammed the tires on all of everything that we were
It's
working on. And but I think that now, with that prevention being gone, it has led to more infection rates here, especially in Shelby County, which we have become the number one in new infections. So if we did have a governor that thought about that, those numbers wouldn't be as high. So I
Mhm.
think that the analyzation of what the prevention looks like before versus what it does now could help change with bringing those prevention funding back, because we do need it to not be that top number of new
Mhm.
infections.
Mhm. Thank you so much. And I just want to kind of point out for everyone. So when the CDC rejected, or when the Tennessee governor rejected the funds from the CDC, Tennessee kind of had to find another entity to kind of receive those funds and give them out to the different community-based organizations. And so United Way was that entity that did that for Tennessee. And so they're still the ones kind of doing that process there in Tennessee now. Okay. And so I just wanted to check in too about what were some of the hardest lessons learned in the early days when you lost the funding, when staff, were laid off, and some of the partnerships kind of went from being partners or collaborators to maybe like competitors. Like, how did you start to rebuild?
I'm gonna do a pros and a cons. So pros were there were a lot of anomaly. It was siloed. We were all siloed. But when the funding got cut, we band together like never before. It was like something so beautiful where partnerships was garnered. There were once strained before. The community came together like a force, and it was like all of the nonprofits, we came together, and we was like, we're gonna do this no matter what's going on. We're gonna make sure that our work is not in vain. And so that's one thing that I can say was beneficial from this, because it made us come together and to strategize. It made us to critical think. It made us think of innovative ways that we could cross the barrier, because we didn't think that it would go on this long. And so the con is, though, people lost their jobs, people lost their way of life, people lost their living. Most of our staff have lived experience. And so being that some of them wanted to say, they feel like they didn't have meaning in their life. And so that's something we try to do, is pour into our women of color, our trans women of color, our trans women of men, just trans men of color, and our black men. And it was a lot of different clubs, and a lot of different just programs that we had initiated from the beginning. And thank goodness United Way came through the way they did, because we were able to keep that momentum going and educate. You wouldn't believe how many young people did not know how to use Narcan, or how many young people did not know that you could get HIV this way, or that, I'm still myth debunking in 2022 and 22 in the age of social media, still debunking mindsets. Oh, I can't eat after them because they have HIV. Oh, I can't do that. And I'm like, no, let's have a conversation. And so getting people in the room, just having those conversations, coming in droves. And so but like I said, people did lose their way of living, whereas we empower sex work. We empower, it's a job. I feel like they should get W-2s, to be honest. It is what I mean, it is. And so, because it's customer service. Let's W-2 it. If you want to take away our funding, let us do what we do so we can survive. People, but all in all, they were able to get the message out while they were working. They were able to touch those people. Like, we had one of our long-term people that we had to unfortunately let go because of funding, but she used to test each of her clients where she did not at first. And so she got her numbers that way, and she was like, I'm gonna test this person, that person. And guess what? Race decreased. She was more aware. She was able to educate them. Although she was doing another service, she was able to educate. That's 2-in-1 right there. And so I wish that people would get out of the mindset that this is bad, that is bad. Overeating is bad. We it's a lot of us, we don't be hungry, but we can sit up there and Thanksgiving. We sit there and stuffed our face with all kind of everything. If we don't talk about what's wrong, that's wrong. To sit there swole and can't move, and you call it the itis. But people in their mind, they have their mindset of what's wrong and what's right. So they get to call the shots on what's funded and what's not funded. And we even in the South, just like talking about the STDs and STIs, and just the different things we contract. We have obesity, heart disease, just diabetes. We have all of these factors that tie into those. So those comorbidities that we have, obesity, cardiovascular disease, on top of high rates of HIV and AIDS and hepatitis C. It's like we built in, and guess who's affecting most? People who look like me. And so, but it's also affecting those who don't look like me. But because they have private physicians and have insurance, they not in the forefront like the people who look like me. How we're in the forefront, and how we depend on resources such as Medicaid, Medicare. We depend on it, but we do go to work, but we depend on it. Our parents depend on it. Our children depend on it. And so it's just Memphis carries, we're the hub of the most African Americans or and people of color who populate Tennessee. It's like Memphis, we in our it's like we are our own state. We're not, we're in Tennessee, but we not Tennessee. We Memphis. And so I want people to understand that we are a whole allotment of our own. We are our own silo. And so that's why when we came together like never before, and we were able to, people were coming out of pockets and stuff. So it's just in those early days, it was like shocking. You know, the initial shock. I'm wrapping it up. The initial shock, but then when you get to, okay, after we get the initial shock, we have grieved, we've done all we gonna do. So what's next? And we did the what's next, and we continue to do what's next. Okay, what's next? And so, and that's what we're gonna continue to do until we get somebody to listen to us, that's in power, that has the money, and that believes in our missions, no matter what and how we look. And so I'm just gonna keep. I'll keep talking, and I know my partners agree with me. We gonna just keep talking. They gonna eventually get tired of us talking and do something. So
Thank you, Rosa. So, this next question, I want Michelle, I want you to start. So now that we're in 2025, and many other states are now facing the same kinds of things that you all faced, a few years ago, defunding, layoffs. What are you seeing that feels familiar, and like what's different?
Um, I would say what's completely different right now is the more of the gutting of more of the funding that we do initially can use in place of those funds that we may have lost. We're to see as many people being laid off, which that is really an issue that we are focusing on, especially with my sister's house, because a lot of people are getting laid off, and that's starting to lead to food insecurity, homelessness, the unemployment rate skyrocketing, and people not being able to find jobs. So that puts people in vulnerable people in vulnerable positions who may have had, like Rosa said, you had somebody who was working, thriving, doing all of this, and then now they're in a space to where that they could be needing housing services right now because they can't afford where they're living, or they got evicted. So a lot of that, I see a lot of what we started, the problem that we did start with, is starting to seem like it's getting a little bit more, because of the different cuts in funding and everything like that we could utilize. But I see a lot of different places, and a lot of different organizations, and like people on social media who have, like Rosa said, came up with creative ways on how to raise money, how to fundraise, or how to spread more awareness on what these funding cuts are doing, and being able to speak to the politicians and the staffers of these politicians on how important these programs are to the people that are in your I mean, they are in their constituency, like their constituents. Y'all are looking at the work that is being done by the administration, and it's messing and it's disturbing your constituents. Like, what are we going to do to bring forth that funding or bring forth that awareness? So, to see all these different places and organizations, not only over over the country, but also here in Memphis as well, thriving to find different ways to combat that loss and try to bring a sense of normalcy and awareness of what we are facing, not only with the funding cuts and everything, but also with everything that's going on with HIV still. We have the CDC has been cut. The scientists at the CDC have been let go of things that are really important to the advancement of HIV. So I think it's more of us having a bigger and broader conversation with the people with the money or the people with the influence to be able to speak on how important this gutting of everything that we deem as essential is going to hurt the population. So like Rosa said, like people are really championing and working together because it's not only just affecting a certain group of people now; it's affecting all of us. It's touching everyone that may know someone who is um, a part of the community of people diagnosed with HIV. Not only that, the families of those people. So you have to bring in all those factors. But I think that a lot of this gutting and everybody striving to work hard to get back to that sense of people care about each other. I think that's really gonna that sense of empathy, that sense of um working towards progress instead of declining. You know, I think that's really been a big driving force with a lot of the communities um, in HIV and also here in Memphis as well.
And Rosa, does anything feel familiar or different to you? And thank you, Michelle, for sharing your thoughts on that.
All I can say is, mirroring Michelle is when a person back is against the wall, they do anything they can to survive. So yes, it's familiar because our crime rates have increased because people are literally in survival mode in Tennessee, in Memphis. And like I said, Memphis populates majority of those of color, and majority of those in color, we're educated, but are we being paid the same rate? Are we being afforded? We have, like I said, we have other health issues. And so you think to tell you mean to tell me if I'm struggling already, I've lost my job because of funding, if I work for an organization, or if the government shut down, I work for the federal government or whatever, I work for McDonald's or whomever. If I'm having access issues to the to clinic or to care, and then I get there and I have to pay a $50, $25 copay, and I'm already struggling to eat anyway. You think I'm gonna go to the doctor? I'm gonna reschedule that appointment, and I'm gonna miss out, and my health is gonna continue to fail. It's a domino effect. It affects everyone in a way. So yes, it feels so familiar because you seeing your people. And even if it's not you today, we are one paycheck away. We are one paycheck away from being in that same position. And although I consider myself pretty okay, I can go to McDonald's and give me a number two every now and then, or give me a pizza, or I can say, oh, I feel like I want to eat this today. There's many people who cannot make those decisions. But like I said, I'm also in that position where I'm like, oh, I need to budget for this because I have a doctor's appointment. I know that I'm going to have to pay that $25 copay, or I know that, oh, I have a surgery coming up and I really need this surgery, but then I have to pay because my insurance didn't finish paying for it, and I don't have Medicaid or Medicare or Ryan White or whatever the case is. I'm gonna have to pay this large thing before the doctor even see me, which is about $1,200, and I know I don't have that because I need to pay my mortgage or my rent. And so it's a balancing act, and it should be a civil right. We should not have to fight for our life to live. We should not have to fight for our life to live. We should not have to like fight for our life to live. And it's like it's so it is like, how do you map it out so that
Mhm.
people can understand when will we come out of this cycle of survival and
Mhm.
come into the cycle of living, thriving, living holistically, living in a mindset of that things are gonna be okay, because tomorrow it's like every day I wake up, I'm like, what's gonna happen next? We're searching high and low for grants. And it's so many organizations, nonprofit organizations, and so many that are small, some are large. Many of the organizations that do the groundwork are small. My sisters have peas, we care, just the different organizations that's small. And guess what? We the last one on the totem pole who will get funding and we're the ones who's on the ground. We not pushing paper. We down walking the streets, testing, offering resources, linking people, following people to their appointment, making sure they maintain care so that we can decrease, so that we can educate. Any small thing, but guess what? We're the last ones to be funded for anything because we're small. They're afraid we can't do the work, but we are doing the work. We on the ground, boots tied, running, and we link together. And so now we like, okay, let's all come in together and write this grant. We can write, and hopefully we get this grant because we partnering together. And it's like we almost got to prove ourselves. Our track record is so robust, but we still have to prove ourselves. And it's like it's just so discouraging sometimes. But also, it's like that fire that you need to say, I'm gonna do what I need to do because these my people. I don't care who you are, where you are, or whatever. Y'all my people. So in that, I'm gonna continue fight. It's some days you want to give up, so you just want to throw in the towel and say, damn if I do, damn if I don't. To be honest, because it's like every time you turn around, you think you making one step forward, it's 10 steps back, and so it's just like, what's next? What's next? Our people losing and in just in these couple months with we did have the funding taken away, but then the Medicare and Medicaid got taken away. And people cannot afford insurance, but then you get fined for not having insurance. But then they took away affordable health care. And so people having to go to the doctor when they can. You got to be almost dead to go to the doctor, basically. And it's just it's so sad. It's just so. It's like what petition do we sign? Who house do we stand in front of and rally without us being at risk of getting shot because we've been aggressive? God forbid. But who attention do we grasp to say we need a chance because our community is dying. We are dying. Lack of education and lack of funding and lack of resources, and we already is one of the most poor cities in Tennessee, where every corner we can't eat healthy. So even if we do get an HIV care, we need to follow up with a diet. Or even if we do have, we like I said, we have other comorbidities, but every corner has a gas station where you can get lunch and meat and some bag of chips, and that's what we eat for the night. But how is that healthy for me? Where's my fruit? Where's my vegetables? We need accessibility to our communities. So yes, it's familiar. It's continuing to be familiar, but guess what? We're going to continue to find a way because we need to find a different source. We need to make a difference. There's nothing different that has happened other than the funding, but we're used to that also because it's a revolving door. So
Yeah, so
yeah.
I want to follow up on some things both of you have said. You talk about our communities, so people who are impacted by obesity, cardiovascular disease. A lot of these are the same folks impacted by being unhoused, people
Mhm.
living with HIV, people who are disabled. So in this kind of, under this current administration, during this kind of time, everybody's feeling the brunt of it. Even if you didn't
Mhm.
used to feel it, a lot of us have gotten very close to feeling the effects of this current administration. And so I just want to hear a little bit more about how your local community is kind of showing up, for people living with HIV, for people who are just impacted, for Black and brown folks, for people who are immigrants. Like, how are you showing up? I know you talked about getting together the right grants, and sometimes, the leaders of your organizations going into their own pockets to buy
Mm-hmm.
things to replace the funding, but what other ways are you kind of showing up, especially when the system that already wasn't perfect
Mm-hmm.
has been broken even more, and the resources we used to have are now disappearing as well? Anybody can
I,
start.
oh, I've been talking a lot. Cause I be on my pedestal. I do my TED talks to myself in the
Yeah, it's
mirror every
okay.
morning.
It's okay.
Because I'm thank goodness we do have we have churches who do food boxes. We also have, like we said, organizations who we refer. So say my sister house may not do have tests, because
Hmm.
you have to purchase those tests unless you have a MOU with another organization. But guess what? Peas don't have access to housing, so but we conduct testing. So I say, hey, I can do you a test, and if you need housing, I can send you over there to my sister's house, and maybe they can help you. Or I can send you over here to get this resource. Or I can send you here to see if you can get some insurance, or see if you can get a discount. Or I know a girlfriend who sell Allstate and could do this. Or come to one of our interventions. We giving out $25 incentives. Maybe go get you a loaf of light bread and some bologna. We know that's not good, but you gonna eat tonight or for the week, and you can make you a bologna sandwich and get you some juice and a bag of chips, and $25 can go a little way into the grocery store. They inflated a little bit, but I concur. But that's how we're coming together with the resources. They're disappearing, but thank goodness we have that dot in between the map that we can connect between each other, so we can say, we can't offer that service, but it's not that it's not a period, it's a and but we got you. And so connecting with that person. And so that's why I said that was one of the only pros that really came out of the funding being taken, and us having to reconstruct everything, is because we're able now to connect with our sister and brother organizations, and able to do that foot on the ground work, where they may have funding for something we didn't get funding for, but we got funded for something they didn't get funded for. So us connecting and having those MOU, not even MOUs, we don't even need paperwork. Us just saying, I'm gonna refer you to this person, having a calling a number like, hey, I got somebody I'm gonna send over there to you. They need help. This is their situation. And just being that warm handoff to that person who needs that at that time. And people are, sometimes we are prideful because you don't want to ask for help. That's just built in us. We all have that. But sometimes you get to the point where you like, I need help because I'm drowning. And I don't know what else to do. And so connecting with our sister and brother organizations, and connecting with church. We even got the churches in Memphis doing right by us and doing what they supposed to do, clap, and handing out food boxes and stuff to the folks. And I'm like, come on, Bible Belt, come on, South, come on. And so it's just continuing, and that's one thing that I'm very proud of, because we have band together like never before. I've never seen people come together in like a way. Dr. King will be very proud. And that's all I'm gonna say. And like that's where I'm seeing more where it was stigmas in different places. Those people are coming out and saying, here, it may not be much, but here you go. Where can you put it? Put it where you can. This. And I'm like, okay, thank you. And it's just a weight lifted just a tad bit, to get you just to that next week, to figure out what you're gonna do to that next week. And so that's where I'm seeing the resources in a broken system come together.
And I'll piggyback on what Rosa said, because like I said, with those cuts, and I think it's a part of something that people of color, I would say, had to do, learn resilience on how to take what you have, the little bit that you do have, and try to spread it throughout the community.
Mm-hmm.
And that's what we've been trying to do, with, if it's not partnering together, when we have events, so everyone will know about the resources that every organization in Memphis has, that is trying to bring in that awareness of what's going on. With I know with my sister's house, we partner with Peace, we partner with We Care Tennessee, we partner with Out Memphis. We do clothing drives. We do food drives. We do, so we try to do as much as we can for the community because we know how to spread, like
Mhm.
take two like Jesus did, take 5 loaves of bread and 2 fish and spread it upon the many, because that's something that we've had to do in the past, and it's sad that we're having to do it now. But being able to have to not be siloed in doing it, to where all the organizations are coming together, like Rosa said, oh, we don't do testing, but oh yeah, Peace does testing. Oh, or you don't have clothing, or you need assistance with um rent or anything like that. Oh, we know this organization over here. So it's able to be a community within the community,
Mhm.
to have that, to expand those resources when we see them disappearing. They may disappear to other people, but we know how to make things strict.
Mhm.
That's one thing I learned. I love that I learned about my grandma. And not even my grandmother, but older people who had to grow up in impoverished times, like how to make this spread to, I can have this and make a whole week's worth of meal, or I can give you this and it can provide you with that next step to get to the next week, and the next week might even be better. So just
Mhm.
that, standing in that gap for the people who don't have it. I think all the organizations in Memphis, and it comes to our Southern hospitality. We're gonna give you, we're gonna give y'all, because I love to say y'all. We're gonna give y'all, we're gonna give people that opportunity to thrive, instead of giving them like, oh well, I'm sorry, we don't have it,
Mhm.
and that be that. We're gonna give them those, even if we don't have it. Oh, we don't have it, but I can tell you this person who does have it. I can point you to this direction. But so having that community within the community helps a whole lot with all the resources that we have seamlessly lost. Yeah.
Yeah, thank you both for sharing. It sounds like the community in Tennessee is showing up to fill the needs related to clothing, housing, testing, food, like so many areas. And I appreciate that you all have that network and you're working together. And even the churches are stepping up as well to even fill the food need, even if traditionally sometimes they struggle with some of the other things related to our HIV service work. So that's really good to hear. I kind of want to switch gears a little bit, maybe to talk about policy, because all of this has to do with policy. These are decisions, people have made, and it's in the community is who's feeling the impact of them. So I want to ask if there are any policy moves happening in Tennessee or that you know about on the federal level that gives you hope about, as Rosa, as you've been saying, what comes next. With restoring our HIV funding or protecting public health? Like, do you have any hope right now? And if you don't have hope and you have concerns, what are they?
I I have no hope, but I have faith that eventually we will be okay, because but even if we're not okay with policy or with the government or our current administration or our governor or whomever, our mayor, whoever may give us these opportunities, even if they don't see our vision, we see our vision, and I feel eventually we're gonna capture the attention of the masses, and we are gonna get the support we need, and then they not gonna have a choice but to help us, I feel. But guess what, at the end of the day, whether or not it comes from their funding or their monies, or it comes from private or whatever, I feel we're gonna be okay. Because this is what we do, and this is how we function, and we know how to make $1 out of 15 cents, and we know how to we where there's a will, there's a way, and as long as the work get done, I'm not saying like it has to lie within us, but if just if it's not us, let it be somebody. Let the message
Mhm.
get out. Let someone be able to help someone where there doesn't have to be a large return, because no one has it to return. So
Mhm.
even if it's not Tennessee, Memphis, even if it's not the small organizations, the large organizations having the power and the drive and the willingness to want to help every person, every human, no matter what color, race, sexual orientation, religion, any culture, wanting to help. All in all, if we can just get those larger organizations or private organizations or whom doctors' offices, hospitals, anyone, food banks. I can go on, but the large people we see who has the money to do commercials and pay six-figure salaries to their C-suite people and all of these individuals, do the work. Do the work. If we're not qualified to do it, if the funding you feel that it's not important for us, because what you don't want is for it to hit home. You don't want it to hit home. And that's my prayer to you. That's my call to action to the larger organizations. You have it. You have residuals. Whereas if we don't spend our money, it's taken away. So we have to spend every cent of what we are granted on these grants that we write for, or it's taken away. We can't sit on it and say, "Oh, we need to save this for a rainy day." So you have it, larger organizations, and wherever, do the work. Do the work. Even also, although even if they take it away forever, and then they could just script it forever, because under how we're going, if it's not a turnaround, and not saying it has to do anything with political party or what, it has something to do with et, your ethics and morality, and you being a human to want to fight the injustice that is occurring with this funding being taken away, because it's a domino effect. And that's what I keep trying to remind people. So even if we can't do it here on the grounds, put someone on the ground to do it. And that's just me having hope. Although I have none in our current state that we're in, where we're just in limbo.
Mhm.
I'm hoping that the call will be a thing, like for schools, HBCUs, all of these people, even not HBCUs, anybody, do the work. You have the funding, you have the money, set it aside and do the work, so that we could save our children, our future. We can have those people who came before us, because I didn't know it all, but guess what? I had a mentor who did, and that's because she was doing the work since the beginning of HIV and AIDS, and beginning of all of these things, core mobilities, and all of these that we suffer through today, and homelessness, and everything that we see is it's not something new. We've lived through this, and we succeeded through it. The only thing is we're new. We the I say millennials, we have been through it all. We have the most tumultuous lifehood we have ever experienced in our life. And I'm like, we gonna be the lost generation soon, because we've been through so much. But I don't have hope that we will. I don't have hope that our current um facet of our political whatever is gonna save us, or going to step up and do what needs to be done. But I have hope that our future will
Mhm.
have the guts to say this is what needs to be done, and this is what we need to do, and we need to get these older non color people out of office, and we need to put people who know the struggle. Even if they not of color, we need to put people in place who are for the people that they truly serve, and not for what can I get back in this. We
Mhm.
need people who are genuine. So that's my call to that. That's my thing. I can go on, but I'm not.
Thank you, Rosa. What about you, Michelle? Do you have any hope or concern?
Um, as far as Tennessee and in general, It's one of those. It's one of those like, oh well, maybe you know.
Mhm.
But I am hopeful because we do advocacy. We do our Day on the Hill advocacy about to inform the politicians who may not know
Mhm.
anything about HIV and how this funding is affecting the state. So I'm hopeful for that. And another, well, I work with the National HIV and AIDS Housing Coalition out of DC, and I'm hopeful that the Senate and the House would increase the the housing funding that they have for the fund. I mean the HOPPA program, which is the housing opportunities for people living with HIV or AIDS, and they decreased it during this past big beautiful. Well, I ain't gonna say beautiful. This big bill that they passed, they decreased the funding from the 525 million to I think 500 million, if I'm not mistaken. Um, which that took away funding from people who needed those housing resources who live with HIV. So hopefully, my hope is with this advocacy that we're doing on the Hill in DC that we could push forward more of that policy in with the housing because housing is healthcare. We have to understand that housing. I know housing is a universal right and housing is healthcare.
Mhm.
And being able to fund the housing resources for people who do live with, because we see the numbers, especially in Tennessee, how being retained in care, virus suppression, and everything goes hand in hand with someone having stable housing, being able to take their medication, being able to be comfortable enough to where that, oh, hey, if I can't make it to that doctor's appointment, I could do a telehealth appointment from my home and be comfortable. So we want to, so the hope I do have for that is that they do increase that funding to help, mm, to help in this epidemic that we got going on because we're seeing that the raising rates do coincide with people being homeless or having to use survival sex or having to use means of, I would say, negative means to provide a roof over their head. So my hope is that though that if I hope that some of these um, politicians, senators, representatives, staffers, or whoever get to see this and understand the importance of how HIV does not is not just a HIV community thing, it's a everybody thing because it affects everybody. It, and yeah, so that's my hope that with hoping that the funding is restored or increased or even even talked about more about around HIV so that they can understand the importance of how HIV does affect the entire community and not just a particular part.
Thank you so much for sharing that, Michelle. So I did want to ask both of you, as folks from Tennessee and who were affected by, rejection of funds a few years ago, what advice would you give to folks, local leaders and advocates who are kind of experiencing this for the first time in 2025?
It won't be the last.
Mm.
And partnerships matter.
Yes.
Partnerships and partnerships and knowing that you're fighting for the same thing or you're fighting to better the community or better wherever you are, they mean a lot. Partnerships, we learned it the hard way. I mean, I'm gonna say the hard way. We learned that partnerships matter with the funding cut. So I would say partnerships, like build those partnerships with each other because we can't do it just one entity can't do it alone.
Mhm.
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 And like what I began to say, it's not the first and it won't be the last. But what we have learned is network. Your come If your organization sends you to a conference, network, business cards, anything, because you never know. You may be up today and they may need you, and then the next time you turn around, you may be low and they say, hey, we have a resource for you. That has been our saving grace. Networking, partnerships, collaborations, even if formal or informal.
Mhm.
Just building those relationships, because relationships last a long time. Bridges, do not burn them, because you never know when you may have to circle back around, and if it's gone, it's gone.
Mhm.
And we have, what we have learned is, we are our own advocate. You are your own. You have to stand on your own. And so when your back is against the wall and you truly find those people who's in your corner, when times are hard, that's where you can turn to. So yes, it's discouraging right now. Like I said, some days you wake up and you like, what's next? Was because this is just the work. This is what we chose to do. And also remembering why you chose to do it. Why are you here? And
Mhm.
that gives you the motivation and all the strength you need. It's like a mother with her child. You like, I love you with all my heart, and I'm gonna fight my hardest to make sure you don't have to go through half of the stuff I went through when I was young. I want the best for you. And so you're gonna nurture your organization, you're gonna nurture your advocacy. And why did you go into public health? Why did you go into this type of work? It was a reason why you chose it. You didn't just wake up one morning and say, hey, I'm gonna go work for this organization. No, you said, I'm gonna go and do this, and this person, this, they follow my mission, they follow my vision, they align with my morals, they align with my ethics, they have the drive that I'm looking for, and they have the voice, that they have the platform that I can use. And so just always remembering why, and what the lasting outcome will be if you
Mhm.
continue to just move forward. And it's gonna, like I said, I repeat again, it's gonna be some days you're gonna be like, I can, like, why? Look, our funding is cut, people losing their jobs. They done fired 2 people from our organization because we don't have any money, and funding is the win. Look, do some Uber, take that pay cut, and keep going, or some DoorDash, or whatever you got to do to get by. And just remember that trouble do not last. It does not last. Right now, we're going through the down part. I mean, we're in the uphill battle. I'm sorry, we're in the uphill battle, but soon we will go down that down slope of the roller coaster. And those are the good times. And so, and that, it just makes you remember when you align, because things happen for a reason. When you align with others who have your purpose and have your same drive, and it brings you together, it just makes y'all even stronger. It's the strongest thing ever, walking hand in hand, elbow to elbow with your partners, and walking and standing for what you believe in, because all of this is a tactic. It's rage bait to just get you to be discouraged, and we're not gonna do that. So that's my forward thinking of it. Trouble do not last always, and it will get better.
Awesome. Thank you both so much for sharing. So, as we're coming up on the end of our hour together, I guess my final question is if you could leave our audience with one truth about this moment, and you've already both shared so many, but like, what's your final thought, your final truth? Like, what would it be?
If there's not room at the table for you, pull up a chair.
My motto, what I'm trying to learn to do is um, lead with love. If you're going to do something, make sure you lead it with love. You know, with everything that's going on, that's probably one thing that we're lacking is the empathy and love. So I would say just lead with love, because that space that's in between, it could be filled with that love to to just bring that next person in who's going to be that advocate, that strong advocate for the next generation, or for to bring in someone who you thought that never would have told their story. So I would say lead with love and just bring that into everything that you're doing within Florida as far as advocacy.
Mhm. Thank you both so much. And thank you to our viewers who were checking us out today. If you ever need us, it's so great working with both of you. Rosa, thank you for doing the show again. And Michelle, it was great to hear from you. And hopefully we'll get to work together again. But it was great to check in with our advocates from Tennessee to see how you were doing and what any advice you could give all of us, kind of experiencing what you all experienced for the first time. So it was so great to hear from you. And we'll definitely be in touch. Thank you so much for joining us today.
Thank
Thank
you.
you.
All right, y'all.
Thank you.